All right, hello everyone. Welcome to today's live webinar featuring updates to our 2022 Outpatient Recognition Programs, Target BP, Change Control Cholesterol, and Target Type 2 Diabetes. On behalf of the American Heart Association and the American Medical Association, I want to thank you for taking the time to join today. My name is Liz Montgomery, and I'm a healthcare data analyst working with the AHA and AMA on all things outpatient. And I'll be presenting today's slides with my colleagues, Allison Smith and Sarah O'Kane. Allison, Sarah, would you like to introduce yourselves real quick?
Sure, thanks Liz very much, and welcome everyone. I'm Allison Smith. I am a public health professional and a nurse and the program director for Target BP. And on behalf of the Heart Association and the Medical Association, I'm delighted to have you all here to share some exciting updates as we wrap up this past year of awards and look to the future. So I'll turn to Sarah.
Thank you, Allison. I'm Sarah O'Kane. I am a healthcare data manager over Outpatient with the American Heart Association and American Medical Association. And my role largely revolves around supporting our 3 recognition programs, as Liz mentioned, and operationalizing those programs each year with Liz's support, as well as some of our other patient level projects that we have percolating. And so I am really excited to present to you all the changes that we have for next year and to have your continued participation and commitment to improving risk factors for cardiovascular disease. So I will pass it back to Liz.
Thanks so much to you both. And before we dive into the content, let's review a few housekeeping items. So first, all participants have been placed on mute to minimize background noise. However, we are accepting questions throughout the presentation in the chat feature on your screen. Please type questions at any time throughout the presentation, and we'll either answer them there or when we pause for questions at the end and allow participants to come off mute at that point. After the webinar, we will be emailing the slide deck and recording. Immediately after the webinar ends, a survey will appear. It should only take a minute to complete, and we would appreciate any feedback you can provide to help us improve our webinars moving forward. So let's go ahead and get started. Today, we will be digging into recognition. We'll start by highlighting the recent 2021 award results. Then we'll move into 2022 recognition changes for all programs, including updated data submission requirements. Next, we'll cover some recognition updates specifically for Target BP. Finally, we will share resources for supporting silver achievement for 2022. First, we want to go ahead and congratulate all of our 2021 awardees and all of the programs. Even in the midst of another extraordinarily challenging year, so many organizations stepped up to submit data and get recognized for their tremendous efforts. This was true across all 3 of our programs, and we know this data will help us understand the ongoing pandemic's effects on chronic conditions. So thank you so much for your work this year, and you can see here just how many patients were affected across the whole United States. If you achieved one of these awards in 2021, you should have already received a congratulations email from the American Heart Association, along with a digital promotional toolkit with resources like a printable certificate and local press release template. Our national websites also have a recognition flyer online for each of our 3 programs. If you haven't had a chance to take a look at these, we will drop links to them in the chat today. They are really great to take a look at because you can see just how many organizations are participating in the program. And then if you achieved an award in Target BP this year, be on the lookout for your plaque if this is your first year participating, or your medallion if you're a returning organization. Those will be distributed soon. Finally, we will again be publishing a national recognition of Gold and Gold Plus awardees in all 3 programs in an advertisement in Modern Healthcare magazine. The image shown is from last year, but our new ad will appear in the November issue, and we'll also have a digital version to make sharing this advertisement easy amongst your colleagues and your peers. So Allison, I will go ahead and pass it over to you to share more on Target BP.
Thanks, Liz, and I want to thank you and Sarah for all the work that you've done as part of the recognition program, as well as all the AHA staff to make this possible, and the AMA staff. And I deeply want to thank all of you participants on the call with us today. This data summary I wanted to share with you because it makes me sort of gasp and appreciate the amazing growth that we've seen in Target BP since its inception back in 2017. And it obviously this table summarizes, we started with 300 plus organizations participating, and we are now exceeding 1,000, which is remarkable. The patient population that we've reached who has hypertension has grown exponentially as well. We did obviously see a little drawback in this past year with COVID as expected, but also looking at the progression of award achievement is remarkable to me. And I obviously more organizations participating and more awards realized by health centers, healthcare systems, organizations across the country is amazing. What we see in this last year of 2021, the one we are in the throes of celebrating now, is that we had record number of organizations submit, over 1,000. And then we also saw a shift because of the addition of the Silver and the Gold Plus awards in how those awards were distributed. And so we saw a drop in the number of those just earning participant because so many more were able to earn Silver. And we'll talk more about this as the presentation goes on. It was remarkable that organizations were able to achieve Gold and Gold Plus in this year of so many challenges. We saw fewer overall Gold awarded organizations, again, recognizing the impact of the pandemic, but still it's remarkable to see so many organizations still participating in the throes of that adversity. And we are looking forward to continuing that as we prepare for 2022. So I just want to share on the next page some additional reflections on this last year's data that you submitted, particularly around the new awards for Silver and for Gold Plus. You all are probably very familiar with those evidence-based blood pressure activity criteria, two criteria around equipment calibration and validation, two around staff knowledge and skills, and then two around systems of care. And as you recall, in order to achieve the Silver or the Gold Plus criteria, you needed to attest to 4 out of 4 or more or out of the 6 criteria. So what I want to share with you on the next page is how those attestations actually were distributed, because I think there's a lot to learn and reflect from it. And at the end, toward the end of the presentation today, we'll share some guidance and recommendations for how to help more organizations get to Silver and more get to Gold Plus in 2022. So the top graph here represents the distribution of attestation responses over all organizations submitting Target BP data this past year. So just walking through this, slightly fewer than half of the organizations submitted were able to attest that they calibrated their devices according to guidelines. The next bar in terms of validation means that 100% of the organizations who submitted, who attested to this question had looked to see if their devices were validated. It doesn't mean that 100% of their devices were validated. It just means that they, when asked to look at a validated device listing, 100% of organizations did so, and that's wonderful. We have a new resource at our fingertips with the US VDL, and we're glad to see so many organizations referencing it, especially as it grows practically every month this past year, and the number of devices represented on it. The two middle bars, the green and the purple here, are similar in their rates of looking at the rate with which we teach blood pressure measurement and test the skills of blood pressure measurement among our care team every 6 to 12 months, so during the year of 2021. And so we're glad to, or actually it would have been during 2020, excuse me. And so it's impressive to see more than 2/3 of organizations doing that, and we will talk more about ways to bump those numbers even higher in the year to come. The next in terms of attestation criteria is the blue bar, or the lighter blue bar, representing the use of a measurement protocol. We're really excited to see more than 80% of organizations using a blood pressure measurement protocol. The one that's a little bit surprising here to me is the last bar, and slightly only over half of organizations attested to using a visual representation, an infographic of some sort, reminding staff how to measure blood pressure accurately. And the rationale behind this criteria was to both serve as a reminder to staff for something that they do millions of times a day, but also as a prompt for patients to be partners in that activity and raise awareness in that patient encounter on how to do that properly. So we'll talk more about that in a little bit as well. And then the lower graph is a representation of the same information, but broken down by the award category. So those patterns are similar, and obviously not surprising that those numbers are lower in the participant and in the gold graphs, because those organizations were not able to achieve that attestation. So with that in mind, I want to turn our attention from what we learned in this past recognition year and shift to a forward-facing orientation of what to expect in the year to come. And so I'll turn it back to Liz to go over some of those important changes.
Thanks so much, Allison. I will go ahead and move into discussing data submission requirements and updates for 2022. So beginning with Target BP, data submission for 2022 will require aggregate 2021 patient data. I'm just going to go over all of the different requirements, some new, some that have existed for a while. So aggregate 2021 patient data is not entirely new. This should be familiar. We're going to be looking for all of the fields here, including total adult patient population, which is 18 years and older, total number of patients ages 18 to 85 with a diagnosis of hypertension and a 2021 visit, the total number of patients ages 18 to 85 with a diagnosis of hypertension whose blood pressure is controlled. If given totals included patients with remote BP readings, the total number of providers, and totals of adult patients' primary payer groups. There are two new changes for 22 for Target BP. There's an updated race and ethnicity field and an adjustment to our validated devices question. So let's go ahead and take a closer look. The new question regarding race and ethnicity patient count reads as follows. How many of your total adult population ages 18 plus self-identify as the following race and ethnicity? The table then breaks that information down into fields following HRSA's Uniform Data System reporting requirements for 2021 health centers. So if you're a HRSA health center, this should also feel familiar to you. This is also probably a little bit familiar because it replaces the prevalence estimator, which we used last year. That had similar fields, but also requested breakdown of sex and age. By updating to the UDS table, we're moving from 45 fields that need to be completed to just the 16 shown here. Hopefully, this reduction in fields will be a welcome change as it'll ease the burden on data submitters by saving a fair amount of time on data entry. The next update is to our validated devices question. In the Target BP measurement activities questions, you'll still need to report the percentage of your organization's oscillometric devices, semi or fully automated, that are validated for clinical accuracy. In 2022, we've changed this field from a text entry to a dropdown, adding an option for not sure if you're unable to determine an approximate or exact percentage of validated devices. To review, any percent range selected from 0 to 100 will denote the review has been completed and will qualify as a completion of one activity for Silver or Gold Plus eligibility. However, if you select not sure, that response indicates the review was not completed, so it will not equate to a completion of one activity. And that wraps up the two new additions for Target BP. Moving on to check, change, control cholesterol, let's go over the aggregate 2021 patient data that will need to be submitted for all patients ages 18 years and older. These fields must be completed for award eligibility. Total adult patient population, total number of providers, totals of adult patients' primary payer groups, total patients meeting any of 3 risk group criteria for ages 21 and older, and then the total number of above patients who are actively using or receive an order prescription for statin therapy at any point during the measurement period. We'll also ask for information on your use of the ASCVD risk score. How is it calculated and how is it documented? There are 2 changes for the check, change, control cholesterol program form in 2022. The first, which we'll look at more closely on the next slide, asks about treatment plans for managing very high-risk patients. The second is that we'll also be adding the race and ethnicity questions to check, change, control cholesterol, as well as target type 2 diabetes. That's the same table we just discussed for target BP. So looking closer at the new question for check, change, control cholesterol, it reads, the 2018 AHA-ACC guideline on the management of blood cholesterol defines patients with existing clinical ASCVD as very high risk of a future event if they have a history of multiple major ASCVD events or one major ASCVD event in multiple high-risk conditions. We ask, does your organization operationalize a specific treatment plan, such as the use of a clinical decision support tool or workflow following the AHA-ACC guideline algorithm for managing patients considered very high risk for future ASCVD events? If you answer yes to this question, there's a multiple choice selection of what the treatment plan includes. Of note, your answer to this question does not impact your award eligibility. That means if you answer yes or no, it won't impact if you receive participant or goal level recognition. But an answer is required either way for award eligibility. Next, let's look at the target type 2 diabetes requirements. The first 3 fields for aggregate patient data for adult patients ages 18 years and older are the same as for check, change, control cholesterol. Additionally, we'll ask for the total number of patients with a diabetes diagnosis and an office visit in 2021. We'll also ask for the total number of patients diagnosed with diabetes whose most recent HbA1c level performed in 2021 is less than 9%. We'll go on to ask for information on your protocols for type 2 diabetes patients. Does your practice have a specific protocol to assess key characteristics of patients with type 2 diabetes? If yes, what characteristics? Then, does your practice initiate a specific treatment plan for patients with type 2 diabetes? If yes, how? The only new addition for 2022 is our race and ethnicity questions. Again, this will be the same question included in target BP and check, change, control cholesterol. And then that will go ahead and wrap up our new data criteria for our 3 program forms. We will have data collection worksheets ready for these by December, so later this year. So be on the lookout for that. Next, I will go ahead and pass it over to Allison to talk about our Target BP Recognition Awards updates.
Thanks, Liz. I really appreciate you walking through all those program changes, most of which really streamline and harmonize those data requirements across programs and hopefully lighten that burden. So I want to talk a little bit about what to expect in terms of the 2022 Target BP recognition benefits. We recognize the significant impact that the pandemic has had on our patient populations as well as the healthcare organizations who serve them. And we've taken a lot of time during this past year to reflect on ways in which Target BP can better support and provide resources to improve blood pressure control. We expected or unfortunately predicted that blood pressure control rates would drop. We had been making significant progress year over year, and then experienced some decline in the pandemic, which wasn't surprising, but we need to regain the ground that we all fought so hard to gain and go beyond that. And so as we thought deeply about how to do that, we really want to focus all of our time, our effort, and our resources on things that will drive improvements in blood pressure control, again, to regain the ground we lost and go beyond. And so with that in mind, we will be evolving the resources, the program requirements, and the benefits in light of that. Part of that was certainly informed by the survey responses that you all provided to us in a survey that we conducted earlier this spring about recognition benefits. And let me just reflect for you that that included you telling us that the reasons why you engaged in Target BP in the first place. Number one answer across more than 100 organizations responding to that was support for your organization's priority to improve blood pressure control, followed by access to the latest hypertension science through program participation and webinars and practice assets, and also the patient education materials. Also, you reflected that you really valued the public recognition, the digital resources that were afforded to your organization as part of the recognition benefits package. So with that feedback in mind, with the challenge in front of us of regaining hypertension control rates, we want to focus on providing additional resources, new guidance around training for evidence-based blood pressure activities, and I'll talk a little bit in more detail about those in a minute. We wanted to lighten the data submission requirements, which Liz obviously outlined in detail in terms of aligning the UDS race and ethnicity fields, as well as simplifying or harmonizing the age requirements or age parameters. And then lastly, we are going to enhance and provide a fully digital recognition benefit package that will have additional assets and templates in it for your use to customize and use within your organizations. And then we will also be shifting, that will include acknowledging participants who are first-time data submitters, as well as all of the Gold, Silver, and Gold Plus awardees. So on the next page, let me just get a little more specific here on what that benefit package will entail. So and again, these benefits will be available to all Gold Plus, Gold, and Silver awardees, as well as participants who are first-time data submitters. And I'm going to talk a little bit about the nuances of that latter category in a minute. But for the purpose of talking about benefits, there's sort of two main realms of in the benefits package. The first is public recognition that HAMA and AMA work on together to recognize your participation, your achievement publicly through a national press release, through the example that Liz shared earlier, the publication of those Gold and Gold Plus awardees in Modern Healthcare. We've done it in other trade publications in the past as well. Acknowledging your engagement at our national meetings for the American Heart Association and the American Medical Association, as well as including that listing, that extensive listing on the Target BP website. Then in terms of the benefits that you receive directly for your use and your celebration within your organization, we will be providing an enhanced digital toolkit, which has, like it has in the past, some of these things are familiar and some of them are new, the principal award certificates, a template for a local press release, other digital banners and seals, some newly added social messaging templates, and also some additional templates for publications and banners. So we hope that those enhanced digital benefits will provide more flexibility and really you can help customize that to meet the needs of within your organization to celebrate, as well as in the communities that you touch around your organization. On the next slide, I'll just mention too that it's not just the recognition program, but it's really how AHA and AMA are looking beyond at the whole hypertension ecosystem. So in addition to what you've experienced through the educational events, the tools, and the recognition resources that are available through Target BP. We work together on raising public awareness in collaboration with the Ad Council and many other national partners to raise public awareness about the importance of blood pressure control, importance of blood pressure measurement, and that campaign that started many years ago has gone through several refreshes and is on the verge of a very exciting refresh that emphasizes self-measured blood pressure to help normalize and socialize the activity of measuring your own blood pressure. So keep your eyes peeled for that campaign launch. But that investment that our organizations are making together is designed to help improve and support that broader ecosystem of hypertension awareness and control. And then lastly, beyond providing more tools and resources as we do directly through the Target BP program, we also have continued to build efforts around federal and state policy advocacy. So AHA and AMA have robust presence and expertise in this realm. And we are constantly looking for opportunities to align the science with policy. And specifically what that means is that we want to make sure that patients have coverage and providers are reimbursed for what the science says. We have made some amazing progress in the last year in seeing expanded Medicaid coverage, for example, for self-measured blood pressure devices. I think last year we advocated to achieve reimbursement for SMBP services that are not quite as extensive as the RPM codes, that are a little more simplified and streamlined to provide reimbursement for that service. We continue that work. As we speak, there is a request in the hands of Medicaid or Medicare at CMS to provide coverage for self-measured blood pressure devices for Medicare beneficiaries, and we will continue advocating in support of coverage for that important healthcare tool. So this is just a sort of a bigger picture than the Target BP program itself of the work that AHA and AMA are doing to really support the broader ecosystem of hypertension control through awareness, through practice change, and through policy and advocacy. With that, I want to turn our attention to just some brief updates around award eligibility for 2022. And on the next slide, I just want to outline the clarification around the participant status. We indicated this last year, but we wanted to clarify and put a little more detail on it, how it will apply in this and become effective in this year to come. So starting in 2022, only first-time data submitters will be eligible for the participant award. The criteria for that award remains the same. It's organizations who complete the data submission but have not yet achieved a control rate of greater than 70% or have achieved fewer than 4 of the evidence-based blood pressure activities. So it's a recognition of your commitment to improving blood pressure control. And so to clarify what counts, a first-time submitter would be an organization who is newly registered or has never submitted data before, or if in an example where a larger healthcare organization submitted overall data, but the individual clinic, for example, had not, would be considered a first-time submitter. What wouldn't count is an organization who had submitted maybe several years ago and just didn't submit last year. That organization would not be considered a first-time submitter again. And there may be some other scenarios that you have questions about, and we're happy to address those concerns and nuances offline. But again, we'll be focusing on organizations who are first-time submitters only in the participant status, and really encouraging and supporting more movement to the silver, gold, and gold plus categories. So on the next slide, just to be clear, the silver, gold, and gold plus categories remain exactly the same. There are no changes to the eligibility or the criteria to achieve those awards. Silver will still be recognizing organizations who have achieved at least 4 of the 6 evidence-based blood pressure measurement activities. Gold organizations are those who have achieved control rates of greater than or equal to 70%. And gold plus will have achieved both the evidence-based blood pressure measurement activity threshold as well as the control rate threshold. Moving on, I just want to highlight again in a forward-facing way what can be achieved between now and the end of this calendar year to make the most of your submission in 2022 and help you achieve the highest award possible. So on the next slide, again, outlining the evidence-based blood pressure measurement activity criteria, again, the same as last year, the 6 different criteria, and wanting you to, hoping that you can achieve at least 4 or more, and that would have to, achieving these during this calendar year, during the year of 2021, would make you, would support your data submission that will occur in 2022. So let's dig into each of these and with some tips and recommendations for what you might be able to achieve between now and the end of the calendar year to increase and elevate your award status in this regard. So for the first 2 activities around calibration and validation, for calibration, this was the trickiest one for sure, and the criteria here is to calibrate all of your blood pressure measurement devices per the manufacturer's recommendation and the evidence base. And so to do that, that would mean being aware of what type of device you had, whether it's oscillometric or aneroid, whether it's wall mounted or handheld, because the frequency of calibration varies based on the device type. And sort of how to get that done is one, if you have a biomedical engineering department or team member, that's your first go-to person. If your organization doesn't have someone like that, we recommend that you contact the device manufacturer for calibration assistance. And there are also third-party biomed vendors and providers that are going to be local or regional that you would reach out to if the other 2 options were not meeting your needs. In terms of validation, again, we encourage you to look at the validated device listing. There are more devices, as I mentioned, being added every month. I know we're expecting at least 3 or 4 more before the end of the calendar year. And so we encourage you to keep checking that device. And as you make new procurement decisions, we encourage you to adopt the standard of only purchasing validated blood pressure devices. This is just my sort of encouragement for you to do so. It is become the standard of care, and it's one of the ways in which we can improve and support health equity, ensuring that all patients served within and at home with blood pressure devices are receiving the most accurate device. On the next slide, I just want to touch on the next 2 criteria around training and testing of blood pressure measurement skills. As you recall, the spirit of this is to train and test skills every 6 to 12 months among our care teams, and that's consistent with the blood pressure scientific statement and the hypertension guidelines. We have 2 resources that were available also last year. The course, the CME and CE course of measuring blood pressure accurately, that is free and available through Target BP. There's also the Achieving Accuracy BP measurement module that has a modest fee associated with it. You are also able to design your own training to satisfy this, but the idea is to refresh staff skills every 6 to 12 months. And similarly, testing those skills, sort of knowledge is one thing and skills are another, and we offer the Technique Quick Check tool as an option for how to do that. There are other skills checklists available as well. One of the new resources that we've created to support your success in achieving silver or gold plus recognition is a watch party toolkit. And what we encourage you to do is to contact your AHA community impact staff to collaborate with them on to access this kit. And it's really a guide for how to customize an event to support your team and really leverage these national science-based assets to make that training and testing easier for your organization and to support your recognition goals. On the next slide, I just want to talk about the last 2 criteria, one of using a measurement protocol, which means really focusing on either obtaining confirmatory measurements by repeating your in-office measurement if a patient's initial blood pressure is elevated, waiting 5 minutes and then repeating, or using ambulatory blood pressure measurement or self-measured blood pressure. All three of these approaches help us achieve a representative blood pressure of a patient with which to make a diagnostic or a treatment decision. So this was an area where there was actually a fairly high adoption rate of measurement protocols, which is great, but I think we were in the 80s, if my memory serves me correctly. So hopefully we'll get to even higher levels of attestation in this space. And then the last one, which I found surprisingly low, the last criteria was to hang a graphic near every place where blood pressure is measured in your organization. And it doesn't have to be this one. We obviously make this one freely available in English and in Spanish. And some sites have given us feedback that they aren't able or don't have a place to hang graphics in their health centers, in their exam rooms. And so here's some just ideas that you might consider, because I think this is a relatively low hanging fruit to achieve this attestation criteria. So either posting on in a bulletin board or having them, in an inexpensive frame, because sometimes paper cannot be hung for, a fire code in your building or your jurisdiction. So that those are options. Using the graphic as a screensaver on the computer terminal, if there is one in your exam room, is another way to achieve that, or laminating it and hanging it from a mobile pump stand as another option. So some food for thought. Just wanting to encourage you all again between now and the end of the year to focus on ways in which you can achieve at least 4 of 6 of those criteria to support your silver and gold plus achievement. And as always, all the things that you're doing every day to try to improve blood pressure control rates to support gold or gold plus achievement. So with that, I think we'll pause to see if there are any questions that have arisen in the chat, and or I'll turn it back to Liz to moderate this next section here. Thank you.
Thanks, Allison. I'm going to go ahead now and unmute our attendees. So you'll still have to unmute yourself if you wanted to come off mute and ask a question, but you should have that ability now. I think we had a question in the chat. I'm trying to I'll read this question out loud, and then Allison, if you have a suggestion. Someone in the chat posted, we're part of a larger health system and we're not allowed to hang graphics that don't come from that health system. What would you suggest?
You're welcome to use any graphic that meets your needs. We offered, I think in the guidance for recognition, some examples of the one that's available in Target BP. There's another one that's available from AHA directly. There are other examples sort of out there. I believe there's some more available in Million Hearts or NACS resources. We are agnostic as to what it is. We just, and if your organization wanted to create its own sort of branded one, we'd certainly encourage you to do so. The idea is because it's a procedure, a measurement happens millions of times a day. It's something that's very easy to lose sight of accurate measurement technique, and having that visual reminder and engaging patients in that to be your partners in proper positioning is a highly recommended practice.
Thanks so much, Allison. I have a couple. One quick one here says, how do we get the screensaver? So I will direct everyone to our targetbp.org website, and I think you should just be able to use that same purple flyer that we had on the screen as a screensaver for your device. Correct. Is that right, Allison? You don't have another version.
Yes, you can download that document. It's a PDF and download it, and it would be, sort of choosing that as your wallpaper or your screensaver. And it's available in different sizes and languages depending on the dimensions of your of your screen if that helps to fit. But that's, or it can be, placed on a different background if that's helpful. So just trying to be creative here. I'm sure there are other creative ideas. If anyone has other creative ideas that they want to share in the chat, we'd certainly welcome those ideas.
Thanks, Allison. I think that sounds great. I love hearing the different ways people are sharing the graphic. I see a couple of questions on data submission. How do you submit data? Who is it that submits this data? Is it providers? I'll just speak to that we have a data submission platform, and you can register for that at www.targetbp.org. That way you can get connected in that data submission platform. When we will open it up for our next recognition period will be in early 2022, but we'll be looking for calendar year data. So from January 1st to December 31st of this calendar year, so 2021. And then once this calendar year ends, that's how we can use the data for next year and moving forward. The data submitter from each organization kind of changes from location to location. So if you have a quality director, that might be the person to start with or ask to submit data. But we certainly see different people from organization to organization based off of who who has access to the data and the time to submit. But we do have resources for all of this online.
And I would just add to your comments, Liz, that for those of you who are new to the recognition program and considering submitting next year, first of all, welcome. We would be delighted to grow our join more than 1,000 organizations in doing so. What we typically do between January 1st and the typical deadline at the end of May to complete that data submission is have a series of webinars and workshops and office hours that help organizations sort of get their arms around the mechanics and the nitty-gritty details of data submission. We sort of walk through those screens and provide guidance and answer frequently asked questions. So there are also additional resources on the Target BP website, or there are last year's resources are there just for reference, so you can understand what type of guidance would be available to you. We will refresh that guidance and make it available by January to support your data submission. So there's lots more guidance to come on how to do that, but we really encouraged to hear that more people might be interested in joining us. So thank you.
That sounds great. And I'll also mention, I see a few people asking if the presentation is going to be available to review after the event. That, as well as our other webinars, will be posted on Target BP. So you can see all previous recent webinars online there. But we'll be sending to those who registered and are participating today an email with more details right after this closes, or within a day of this closing, and more and the closed captioned webinar will be online within 2 weeks at targetbp.org. All right, I see a question on how often do we submit information? It is once a year, so we will ask you to submit your data. I believe it'll be by May of next year, so between January and May, but we will have those official dates that the data platform is open published soon. So be on the lookout for an award announcement, but only have to do it once a year for our recognition program right now.
Any other questions? Well, we really appreciate everyone. Oh yeah, please.
Hi, I do have a question in regards to the number of providers. So with the question it's in all three, the blood pressure, the cholesterol, and the diabetes. For the total number of providers who manage hypertension, in the past, we have only submitted our primary care providers, meaning the physicians, the nurse practitioners, or the physician assistants that are working in the primary care. But there are a lot of patients could be managed with their hypertension through their cardiologist, and same thing goes with diabetes. Sometimes it could be their primary, sometimes it could be the endocrinologist. Should we try to include, it could be both. I mean, we're such a large organization. There's no way to individually, we have to do this, you know, through regular data pool. Any suggestions on how, what groups we should include?
This
Well,
is Sarah, or, oh, did you want to go ahead, Allison?
No, I was just going to say, I appreciate the point that you made, just clinically speaking, and I'll defer to Sarah for the data recommendation, but it's certainly the reality is that many patients are co-managed. And so there's not a super precise way to handle that. But Sarah, do you want to comment on the data guidance?
Yeah, I would just say there's not necessarily a right or wrong answer for that question. I think the intent is for us to try and capture the number of providers who are treating the patients that are being included in your controlling high blood pressure data submission. So if visits with their cardiologist are included in the denominator for that measure submission, then it would be best if those providers were also counted in your total number of providers. But if that's just encompassing your primary care visits, then probably best to match just mention the total primary care providers.
Okay, thank you.
Thank you.
Any other questions or comments? Or I have just another minute or so, and you're always welcome to submit comments or questions to the contact us on targetbp.org. The AHA field staff are amazing resources in this regard. I'll turn it back to Liz, I suppose, to wrap us up or make any final comments, but really appreciate you all joining us today. Thank you.
Yes, thank you everyone for joining us. If you have further questions, like Allison said, please feel free to reach out via the Contact Us form. I've got the link here. We'll also be, like I mentioned earlier, sending an email out here shortly after the webinar closes to just share all of these details again. But along the way, please feel free to reach out, and thank you for attending the webinar. I look forward to seeing and helping everyone submit data for 2022 recognition. If you can, we would love it if you would provide your feedback in the post-webinar survey as we close out the call. So thank you so much, and I hope you guys have the great rest of your day.
Very good, thank you.